Thank you very much, Senator Alexander, and all of my colleagues here who have worked so hard on this very important insurance stabilization and rate reduction package. Congress faces a fundamental question. Do we want to take action to significantly reduce the cost of health insurance for millions of Americans, or are we going to miss this opportunity? If Congress fails to act, insurance rates in the individual market will skyrocket this fall. This will directly harm the 9 million Americans who pay for their own insurance without government or employer assistance, such as a fisherman in Maine who is now paying $10,000 for his insurance premium with a $5,000 deductible. It will hurt low-income Americans who would receive help to pay for their deductibles and co-pays. Healthcare premiums are already too expensive under the Affordable Care Act. Last year, the average price of the Obamacare Silver plans, which are the most popular plans, increased by, on average, 34%. A growing number of counties in our country have no insurer or only one insurer. Inaction will only exacerbate the premium spikes and market instability that we have already seen. Americans expect us to come together to provide real relief from the rising cost of health insurance, and that is exactly what our plan would do. Our proposal is the last opportunity to prevent these rate increases from taking effect this fall, and our package will help stabilize the market. Every study has shown that our bills would make health insurance more affordable. For example, according to the leading healthcare experts at Oliver Wyman, the legislation we have proposed would lower individual health insurance premiums in the individual market by as much as 40% compared to what people will pay if Congress doesn't act. It will also, according to Wyman, expand coverage to an additional 3.2 million individuals. Dozens of healthcare, consumer, and business groups have called upon Congress to take action to lower premiums for millions of Americans and their families. These groups include the American Hospital Association, Blue Cross Blue Shield, the U.S. Chamber of Commerce, the American Medical Association, and a host of patient advocacy organizations. It would be incredibly disappointing if some members derailed this serious effort to reduce the cost of health insurance for millions of people. While members may disagree with certain provisions, the time has come for each member to decide, are you for lower rates and more affordable coverage for the 16 million Americans who get their insurance from the individual market, or are you for sitting back and letting their insurance rates go up once again this fall, making health insurance even less affordable? In my view, the answer is clear. We must not lose sight of what the goal is, and that is making health insurance more affordable for millions of Americans. Including these bills in the omnibus is the right thing to do, and it is urgent that we do it.